Yeah, so that's my story, and that's what I'm getting to. My introduction is about me sharing a bit of myself. Now, as you go into your communities to work, there's going to be it's going to be different to working in a hospital system or working in a mainstream GP, mainstream what do you call it? Health service, health centre, where it's 10-minute appointments. You know, you're in and out. There's those sort of clinics I go to in town when I know I just need something. I want to get in and out. But then when I want to sit down and talk to someone, I go to my local, to Danila Dilba. And the thing is with our health services in our communities is it's very important that you go in and build that trust. And one of the best ways that you can build trust is by sharing your story. I think sometimes working from the point of view of working in a health centre, we can be, like I've worked in Miwatch and Wurli as an Aboriginal health worker. And you can be faced with a situation where doctors come and go, and some doctors come and they form relationships. Others are just there to do their job and go again, and there's not a lot of that forming of relationships. And it's the ones that form relationships with the people and with the community that have much more fun, and they also have better health outcomes because people want to come and spend time with them. So I just encourage you to share your story, and that's how you're going to build that trust and that rapport. And like now, normally I would say my name, who I work for, short story about, but I gave you a little bit more of me, and that was the purpose of that introduction. So now that you probably know me a little bit more, you don't know me, a lot of you don't know me from a bar of soap, but now if you see me somewhere, you'd probably feel a little bit better about saying hi or having a yarn or whatever, because I've given you a little bit of myself. And that's the same with our mob in a community. If you give a bit of yourself, they'll feel more happy. If they know they got an appointment with you, they'll be more likely to come back. So the other point is in a health centre setting, in our community controlled health services, they're very non-hierarchical. So where you may have been used to that hierarchy, in a health centre, everyone is basically on the same level. You probably already do orientation where you're encouraged to get involved in community activities. And that's not just community activities, if the football's on or things like that, or there's a disco for the kids, all of that's really good. But even funerals, you earn a lot of respect, by paying your respects and sitting down if there is a funeral, things like that. Make sure every community's got different protocols. I'm probably covering stuff that you do cover in your orientation, but this is just things that I think are important when you're looking to go and work in an Aboriginal community controlled health service and you want to form a relationship. And that's what the staff want there, and that's what the community wants. They want you to go and form a relationship with them. So who forms the foundation of the health centre? So some might say that it's the doctor, some might say it's the clinic manager, but who really forms the foundation of the health centre, especially a community control, is the community, and it's most importantly the Aboriginal staff that work in that health centre, because they're still there when everyone else has come and gone. They are the foundation of that health service. So in a health service, there's all workers are important,